Welcome to ColoradoPERA's Planning for Medicare presentation. I'm Jeff Sproul, a field education representative at ColoradoPERA. This presentation is designed to give you an introduction to Medicare and how it interacts with ParaCare's Medicare coverage. However, as an employee of ColoradoPERA, I do not represent Medicare. You should always check the Medicare website or request Medicare publications from the local Medicare office for questions specific to Medicare. During Part 1 of this presentation, we'll cover Medicare's four main parts: who is eligible for Medicare, and an overview of coverage. In Part 2 of the presentation, we'll cover more specifics about how ParaCare Medicare plans work with Medicare. The information will help you with decisions about your healthcare coverage. Finally, we'll go over some of the resources available to you about Medicare that provide much greater detail than we've included in this presentation. Let's get started by talking about the basics of Medicare. After you have signed up for Medicare, you'll receive a Medicare card in the mail. Be sure to keep it safe. If you decide to enroll in a ParaCare Medicare plan, you'll need to make a copy of it and send it to Para to show that you are covered by Medicare. Medicare is health insurance for Americans aged 65 and older, and for persons under 65 with certain disabilities. Today, Medicare covers 39 million seniors and another 8 million younger beneficiaries who receive Social Security disability insurance payments. Some people confuse Medicare with Medicaid, which is administered by the state for people who are below a certain income level. Medicare helps cover the cost of health care, but does not cover all medical expenses. For this reason, many of you want to learn about additional coverage available through ParaCare. While Medicare is administered by the Centers for Medicare and Medicaid Services, or CMS, your eligibility and enrollment will be processed by Social Security. You will most likely be eligible for Medicare on the first day of the month in which you turn 65. You must be a citizen or permanent resident of the U.S. to be eligible for Medicare. You are eligible on the first day of the month in which your birthday falls. If your birthday is the first of the month, you will be eligible 1 month earlier. For those receiving a Social Security disability benefit, you will become eligible for Medicare in the 25th month of disability coverage. The four parts of Medicare we will discuss include Part A, which is hospital insurance. Part B is medical insurance, and you must enroll in Medicare Part B if you want to participate in a ParaCare plan. Both Parts A and B are administered by the federal government, and you may hear them referred to as Original Medicare. Part C is also known as a Medicare Advantage plan, and Part D is prescription drug coverage. You cannot enroll in Medicare Part D if you want to be covered in ParaCare. Part C and D are offered by private insurance companies. Let's take a closer look at each of the four parts. At age 65, most Para members will qualify for Medicare Part A coverage. You are eligible for Part A at no cost if you are eligible to receive either a Social Security worker benefit or spousal benefit. You will also qualify for Part A coverage at no cost if you paid the Medicare payroll tax for at least 10 years. If you do not qualify for free Part A, you don't have to purchase it. All of the ParaCare Medicare plans provide a replacement hospitalization benefit. Medicare Part A covers inpatient hospital care, skilled nursing facility care up to 100 days, home health visits following hospitalizations, and hospice care. Employers and employees pay 1.45% of earnings to the Medicare Hospital Insurance Trust Fund to fund this hospital insurance coverage. Everyone is eligible for Medicare Part B coverage at age 65, regardless of whether or not you have earned 40 credits in Social Security, and everyone must pay a monthly premium. This premium represents about 25% of the cost of the medical insurance. Medicare Part B pays for 60 to 80% of most outpatient and physician care charges, leaving you and or your supplemental Medicare plan to pay the remaining 40 to 20% of charges. Medicare applies a penalty for delaying enrollment, which results in a higher premium. We will discuss the enrollment process, including the penalty, in a few minutes. The 2010 premium for Medicare Part B is $110.50 per month for most of you. However, if you have a higher income, as reported to the IRS, your premium may be higher. At the filming of this presentation, the 2011 premiums had not been released. You can find the 2011 premiums online at medicare.gov when they are available. The monthly premium for Part B coverage must be withheld from your Social Security benefit. If you do not receive a Social Security benefit, PERA can deduct your Part B premium from your PERA benefit, or Medicare will bill you quarterly for your premiums. Please contact PERA for an authorization form to withhold the premium from your monthly PERA benefit. DPS retirees currently do not have this option. It should be available in 2011. Medicare Part B provides coverage for medically necessary services like doctor's services, outpatient hospital care, preventive services, x-rays and diagnostic procedures, and durable medical equipment. Part B is financed by monthly premiums paid by enrollees and by general revenues from the federal government. Remember that you must be enrolled in Medicare Part B in order to enroll in any of the ParaCare Medicare plans. Prescription coverage is very limited in Medicare Part B. Additional information about more comprehensive drug coverage under Medicare Part D and ParaCare will be discussed in Part 2 of this presentation. Original Medicare does not cover dental or vision care. However, ParaCare offers optional dental and vision insurance. Since long-term care is not covered by Medicare, PERA has partnered with MetLife to offer optional long-term care insurance. More information is available on PERA's website. Cosmetic surgery, hearing aids, and hearing and eye exams are also not covered by Medicare. Medicare does not provide coverage while you are outside of the United States. The ParaCare plans do provide some international coverage, with the HMO plans providing emergency coverage only and the Anthem plans covering services received outside of the U.S. Medicare Part C is what's known as a Medicare Advantage plan. Part C is healthcare coverage for all of your Part A and Part B coverage needs. If you are enrolled through a ParaCare plan, you only need to have Part B. Then, Medicare pays a fixed amount to your carrier every month to manage your care. You receive your care through the plan's providers and facilities. We will cover the 2 Medicare Advantage HMO carriers available through ParaCare in Part 2 of this presentation. One of the newest benefits added to Medicare several years ago is Medicare Part D. Part D covers prescription drugs and is offered by private insurance companies to anyone enrolled in Medicare. Most likely, you have received mailings or seen advertisements by private insurance companies about their plans. All ParaCare Medicare plans provide you with creditable prescription drug coverage, so it is not necessary for you to purchase an additional Part D plan. Once again, if you choose to enroll in ParaCare, you must not enroll in a separate Medicare Part D plan. Now let's discuss how you enroll in Medicare. You enroll in Medicare through your nearest Social Security Administration office or at socialsecurity.gov. If you already are receiving a benefit from Social Security, you will be enrolled automatically. While Social Security can tell you if you qualify for Part A, you will want to enroll in Part B. 3 months prior to your 65th birthday, the initial enrollment period begins and you may enroll in Medicare. To have coverage effective when you turn 65, you must enroll by the month prior to turning 65. If you don't enroll during your initial enrollment period, you may have a late enrollment penalty. If you miss your initial enrollment period, there's a general enrollment period each year from January 1st to March 31st, with coverage beginning July 1st. A penalty of 10% of the Part B premium may be assessed for every 12-month period that has lapsed since your initial enrollment period. However, if you have group health insurance through your or a spouse's current employment after age 65, you have a special enrollment period that allows you to enroll in Medicare within 8 months of termination. As a reminder, if you want to enroll in one of the ParaCare plans, do not enroll in another Part C or Part D plan. This concludes the Medicare overview section of the Planning for Medicare presentation. You may also be interested to watch Part 2, which reviews the different ParaCare plans that are available to work in conjunction with Medicare.